prayer heals. A number of patients, one in particular, who came to me with a liver tumor and was clearly healed, chose no other treatment except prayer from his church and a prayer circle that went around the world, and his tumor went away. Based on my personal experience and the research that's now out there, prayer heals.
So, okay.
Okay.
You understand what we're doing?
I understand what we're doing because I invented it.
I know. So, spell your name for me, sir.
O-N-I-K.
Good. And your first name?
Gary.
May I call you Gary?
You may.
Good. And your date of birth?
2/25/52.
Wonderful. Okay. Gary, I'm going to have you sign your consent. You're going to have Dr. Vaughn do a transperineal prostate biopsies. Okay, you understand the risks,
I sure do.
consequences,
I created them.
the benefits.
I do.
Okay, so we'll have you sign right here. Top line. Anything to eat or drink past midnight?
Nope.
Nope. Okay. Any allergies to medicines at all?
Nope.
Okay, good.
I want to thank everybody for coming and doing this. This is kind of unusual.
Very unique situation.
Okay.
Good news for the 180,000 patients diagnosed with prostate cancer this year. A local doctor is putting the freeze to the disease.
There may be new hope tonight for patients with cancer of the liver. Doctors at Allegheny General Hospital in Pittsburgh have found a way to freeze cancerous liver tumors and stop the disease that kills more than 6,000 people every year.
Dr. Gary Onik.
Dr. Gary Onik. Dr. Gary Onik.
Dr. Gary Onik.
Dr. Gary Onik.
The problem is you're dealing with patients' lives here, and you want to give them the most time-tested treatment.
At 5 years, we're looking at approximately 80% of patients with no evidence of disease.
If you had to choose the procedure today, what would it be?
Oh, I have cross surgery, no question.
No question.
No question.
Incremental advances in cancer treatment are being made every day, but major breakthroughs in curing cancer don't occur by committee, no matter how many resources are thrown at the problem. They spring, like most scientific discoveries, from a creative insight by an individual prepared to see the answer. What follows is the story of Dr. Gary Onik, a renowned cancer researcher whose spiritual journey is culminating in the discovery of a breakthrough cancer treatment which promises to change the course of medical history. Dr. Onik, currently an adjunct professor of mechanical engineering at Carnegie Mellon University, is not new to insights that advance cancer treatment in large leaps. When he was in his late 20s, he had an inspirational concept called image-guided tumor ablation, which would impact the field of cancer treatment like few others do. Gary, then a radiologist in training at the University of California, San Francisco, saw patients dying because the cutting and sewing of traditional surgery was unable to remove their tumors. He postulated that if he could use imaging such as CT to minimally invasively guide a destructive probe into the patient's tumor, he could destroy the tumor and have the body remove the dead cancer. In this way, he could save the life of a patient whose cancer could not be removed.
An unresectable tumor is one that can't be removed, usually due to its location, proximity to vessels or structures that can't be sacrificed. If radiation or chemotherapy cannot totally destroy the tumor, then that patient is basically incurable. When I was a young man, almost 30 years ago, I introduced something called image-guided tumor ablation, which changed that scenario. Finally, we had a method that could reliably destroy and kill a tumor that couldn't be surgically removed or treated by radiation or chemotherapy.
My story began when my husband and I decided that it was time for us to begin a family. We had some problems, and there was a situation where I was anemic, and over the course of the year we discovered that I had a small tumor in my small intestine, and I had it surgically removed, and they told me that I should consider coming back and keeping track because they were suspicious of what they saw. So I went back and I had CAT scans done, and the surgeon that I was working with at the time was a local surgeon in my community, and he said, "Marsha, there's something suspicious here," and said that it was most likely a metastases on the right lobe of my liver. I discovered that there wasn't anything they could do, and so I went down to Allegheny General in Pittsburgh, and I met Gary Onik.
Marsha had 8 tumors within her liver, one of which was sitting on the inferior vena cava, the major vessel that brings all the blood from the lower half of your body to your heart. It was clear that not even the best liver surgeon in the world could surgically remove Marsha's tumors. The operation I performed on Marsha had never been performed before. As an analogy, it was as if I was writing notes down to a beautiful piece of music and they were being played in real time. Interestingly, no one wrote the notes down. I only performed that operation once. In retrospect, it was far too dangerous, and I realize now that God was working through me to give Marsha a great gift.
He was the person who I put my trust in, and it was actually what saved my life. I recovered very quickly, and I have never looked back. Originally, my liver looked like the moon. It was all mottled. It had spots everywhere. And over the years, I watched it as it actually began to smooth out.
It was clear that Marsha had microscopic disease in her liver and other parts of her body that we could not identify. So we expected this operation to be a rather stopgap measure. The fact that Marsha did not recur with tumors in other parts of her body and in the liver was a clue to us that killing a tumor and leaving it in the patient's body could have actually a beneficial effect. That we, in a sense, were creating a cancer vaccine out of that patient's tumor. The patient's immune system would recognize that tumor and then go to other sites where the microscopic disease is and kill those tumors. That's called the abscopal effect.
My name is Dr. David Bostwick. I live in Orlando, Florida. I've known Gary Onik, Dr. Onik, for about 20 years. I perceived him initially as someone who was thinking in ways that the conventional wisdom did not normally think. He thinks differently. He anchors all of his thought in the scientific literature, but he pushes the limits, and in doing so has hit the target virtually every time. In 2007, we really became close when we jointly sponsored a meeting on focal therapy for treatment of prostate cancer. At that time, men were being treated with radical prostatectomy or radiation therapy with all of the side effects. But interestingly, breast cancer had been treated for more than 20 years at that time with focal therapy, lumpectomy, or other things, again, for selective women. Not every woman is amenable to those types of treatment. So we asked the question, could prostate cancer be treated the same way, or at least in a similar way, again, for select men? And it turns out that they can be. Gary had been using cryosurgery with remarkably good results in select patients, but it does not work predictively for people with metastatic cancer. So some of them got an incredible result, but most did not with cryosurgery by itself. When Gary came to me with the idea of a new method, an exciting new method of destroying tissue, I found it immediately, obviously, of benefit. I thought it would be a leap forward. And I suggested, in discussions with him, this is both of us working together, that if we wed that to immunotherapy, it could be extraordinary.
Jeannie Berry was a perfect patient for irreversible electroporation. She had a cancer that was recurrent in the floor of her mouth. Radiation and surgery would be grossly disfiguring and wouldn't have assured her that she would even have her cancer completely treated in any case. Irreversible electroporation, or IRE for short, was a modality that I developed with my long-term collaborator, Boris Rubinsky, who is a professor of mechanical engineering at UC Berkeley. Irreversible electroporation, or IRE, punches holes electrically in the cancer cell covering membrane, and in that way kills the cancer cell.
I was diagnosed in February of 2014 with squamous cell carcinoma on the floor of my mouth. They didn't tell me what was going to happen to me. I woke up with the scarring, a speech impediment. I had drains that were infected within 2 weeks. Had to go back for another surgical procedure. So at 8 weeks, I went in for a checkup, and my cancer was already back in the floor of my mouth. So the surgeon told me, I need you to have radiation, and if you do not opt to have radiation, I will not remove the second tumor. It would have been a feeding tube for 1.5 years. My throat would have closed shut, couldn't talk, couldn't eat. So I refused the radiation. And he told me 3 times in that consultation that day that I was going to die a horrible, painful death. So I had a friend visiting me that week, and I went home and told her, you know, I'm going to die. He's given me 6 months to a year at the most. And he won't even take the second tumor out. And of course, we were both crying, upset. And she says, which is the first miracle, she says, I have a friend that may be able to help you. And she knew Dr. Onik. So within a week's time, I was in Florida having the IRE procedure. And I had the pleasure of meeting him. And he took care of it. I was in recovery, and I wake up to the prettiest gentle eyes, and he's sitting on a stool by my bed. And he said, what I want you to do for me is to go home and live your life. You're cancer-free.
When you try and change the course of medicine, particularly against entrenched interests, there's going to be criticism, and that's only natural. It's expected. It's part of the game. A few things happened in my career along those lines that left me with significant bitterness. At that time, I was still after the accolades, the fame that was associated with being a world-class cancer researcher. I mistakenly thought that it was actually about me, and I was very, very wrong about that. I was at a medical meeting, and a comment to me from one of my colleagues prompted what I can only describe as a spiritual epiphany or awakening. In an instant, I realized that fame, fortune were irrelevant, that I was able to give up all of my bitterness and forgive all of the people that had done things to me that had given me that bitterness. I felt a calm come over me, and for the first time in my life, I was truly happy. I realized that I was given a gift and that God was working through me to treat these patients individually, but also put forth these cancer treatments that were going to help tens of thousands of people.
I'm Dr. Joe Maroon. I'm a neurosurgeon at the University of Pittsburgh, and I specialize primarily in problems like brain tumors, trauma to the brain and spinal cord, and lumbar disc disorders. When I think of Gary, I think of a quote of Helen Keller, who said many years ago, "I'd rather be blind than not have vision." Gary is one of the most visionary individuals in medicine and elsewhere that I've met in my entire career. And our relationship began in 1986 when I, one Sunday afternoon, was reading an article that he wrote in the American Journal of Radiology on a new technique of inserting a needle or probe into the disc of an animal at that time and aspirating the disc, a percutaneous discectomy. And when I read this article, I literally picked up the phone and called Gary in California, told him who I was, and said, "Look, I'd like to learn more about this unique procedure that you've developed, and would you be interested in visiting in Pittsburgh?" And after our conversations, our visits, I was very pleased and proud to recruit him to come to Allegheny General Hospital in Pittsburgh, where he was, I believe, one of the very first, if not the first, interventional radiologists to be recruited and hired into a department of neurosurgery. We've operated on hundreds of patients and used his technique to relieve pain without surgery as an outpatient to remove discs. Over the course of the next several years, Gary became very interested in treatment of tumors, particularly the prostate gland. And he developed again, a visionary, unique approach using cryosurgery, a probe half the size of a pencil that the temperature could be dropped tremendously so that the surrounding tissue would literally be frozen and the cells therein destroyed. These were the visionary things that that took me around the world, literally, with him, giving talks, putting on courses, lecturing to other neurosurgeons, orthopedic doctors, subsequently with him, urologists, liver cancer specialists. As the Pittsburgh Steelers team physician for over 25 years, having won 2 Super Bowl rings myself with the help of the Steelers, I often have thought, preparation for this interview to some extent, how would I rank Dr. Gary Onik in the pantheon of stars relative to NFL football? Franco Harris is a close friend, Lynn Swann, Jack Lambert, all the old timers who were in the vintage when Gary and I were playing our game, so to speak. And there's just absolutely no doubt that he would be in the Hall of Fame. And more importantly than a Hall of Fame, his innovative techniques devoted to relieving pain and hopefully curing patients of malignancies puts him at the very top of the list in any Hall of Fame and in any category.
I met Gary for the first time in 1972. At that time I was an assistant professor of medicine at Harvard at Peter Bent Brigham, and my wife Kathy was a chief technician in cardiology. We were interested in whitewater boating and started the Harvard Whitewater Club by an ad in the Harvard Crimson. Gary, who was a student at Harvard College at the time, responded to that ad, and we met him in my lab. He went on and became a really world-class whitewater kayaker. But back in '72, his first interest was in medicine, started at the Brigham. Gary went on, graduated first in his class in medical school, and then in residency in radiology. And while in training, he was the first one to do image-enhanced biopsies of liver metastases and treat them eventually with cryosurgery. There were some other personal things that Gary and I had going. One was my daughter's mother-in-law had a large metastasis from carcinoma of the bowel to her liver. And it was so large that Gary felt that he could only freeze it by open approach. And in Pittsburgh, where Gary was working at the time, he and I went into an OR and we opened the lady's belly, and a direct operative ultrasound showed that the tumor was much too big and close to the vena cava so that it couldn't be frozen at that time. And we sort of looked at each other and said, well, what's next? And they said, well, wait a minute, why don't we put in a pump for chemotherapy under the skin and feed it directly into the liver, and which we did. That it had never been done before was irrelevant. It was typical of Gary's innovative approach to these things. And we closed her up, and 6 months later, the tumor had shrunk enough that it could be frozen, and she lived 6 more years.
If he did such a great work, how come that he's not rich or famous?
I believe he is famous, but I would agree he's not rich. He spent a significant amount of money on his catamaran boat that he lives in, but he's spent his career on research rather than on patient volume, and did not generate the income from patients that he might have if it wasn't for the research that he was doing.
Freed from the need for professional recognition and content with the many contributions he had already made, Dr. Onik did something in 2011 that shocked everyone who knew him or knew of him. He stopped working. He stopped inventing. He dropped out of sight for 3 years. Rumors flew. What could possibly have gone wrong? Where in the world was cancer treatment's most prominent nonconformist? Well, he went to boat mechanic school for a year. Yes, boat mechanic school. He then sailed his catamaran Ice Wars 2 8,000 miles, around Florida, up the East Coast, through the Bermuda Triangle, and around the Caribbean. But why? Midlife crisis? Something worse? No. It was because of a young man named Alan Onik, Dr. Onik's son, who has Asperger's syndrome, a mild form of autism. Alan had just graduated from college, and he wasn't working or thriving. Dr. Onik and his ex-wife, who had guided Alan through college, were concerned. With his typical flair for outside-of-the-box thinking and Alan's mother's encouragement, he enrolled himself and Alan in boat mechanic school at the Landing School in Kennebunk, Maine, to give his son a sense of purpose. A year later, with the course completed, they finished building their sailboat and embarked on an 8,000-mile sailing expedition together.
It was hard for my colleagues to understand how I could walk away from medicine research at what was arguably the top of my game. Boris and I had just finished development of irreversible electroporation, and it was entering clinical trials on pancreatic cancer patients. And at the time, I felt that I had done what I needed to do in medicine. Coming up with a new cancer treatment is very much a creative endeavor. It's kind of like, to use another musical metaphor, writing a hit song. Are you going to be a one-hit wonder? Well, I knew I wasn't a one-hit wonder because I'd had a number of inventions, but you can't see that there's going to be something past that. You just don't know. And I felt like I had done really what I had needed to do. And I think it was basically time to do something else and spend some time with my kids. My two oldest were well on their way. They were doing great. When I came up with the idea of sailing away, they had their lives and weren't going to leave to go do that. But Al, my youngest, is on the autistic spectrum, and he was, needed something to do, something that could make, hopefully, both of us grow. So with the input of his mom, we went to boat mechanics school together for a year to prepare us for getting on a boat and sailing away.
Oh, wow. Look at this. Unbelievable.
That turned out to be a life-affirming and changing experience for me, and would never regret taking that time away.
I'm Jim.
And I'm Carol.
And we're friends of Gary. I met Gary on first day of freshman year of college in August of 1970. It was the day we all moved into our freshman dormitory. I got there first, and my family had left me, so I was there alone when Gary arrived. And he came with his mother and his stepfather, Harry. His mother's name was Sonia. And I had the pleasure of getting to meet Sonia and her son Gary, and we enjoyed getting to know each other and talking. As Sonia was leaving and saying goodbye to Gary, she turned to me and asked me if I can't do that, I'm sorry. As Sonia was getting ready to say goodbye, she was standing in the doorway at the hallway of the room, and she turned to me and asked me to do her a favor. She said to me, "Misa, will you promise to take good care of my son Gary?" And I was surprised, but I could see that she was sincere and concerned. So I said to her, "Sonia, I promise I'll take good care of your son Gary."
And I remember first meeting him and thinking, he is just a lot of fun. He had a great sense of humor and a contagious laugh. And he was silly at times. And I thought, this guy, he's just really a nice guy. And so our relationship goes back a lot of years. And it's a very special one. It's a friendship that probably will never end.
Hurricane Sandy happened, and Gary was caught here in Brantford. Gary's boat was tied up at the dock during Hurricane Sandy, and his son Alan stayed here in our house with us that night.
Yeah,
Gary stayed on the boat.
Storm, yeah.
I remember how frightening that was. And so Gary stayed here through Hurricane Sandy, but had made the decision that he wanted to go south. So after Sandy cleared and he found himself ready to go, fortunately his boat survived well. Gary left with a decision to make about whether or not he wanted to continue to try to come back to medicine, having not found a place here in the Northeast that would help him do that, Or his other alternative was to go back to Florida and become a charter boat captain. And he had
Yeah, that's right.
charter boat robes and
He
shampoo
did.
with
He
the-
went shopping and he purchased some lovely, fluffy terry robes for the members of, whoever would sign up for his excursion, and some lovely bath, shower gels and different things. So we thought, well, there he goes, and maybe he's going to just begin chartering his boat. We had no idea actually what
we
was
did
going
not
to
know
happen.
which way he would go.
No. Mm-mm.
Well, eventually, as he got to Florida, he made the decision to try to practice medicine, and we had discussed methods and means by which he could do that. And ultimately, we were able to help him to begin that process.
And that's when cancer research lightning struck again. With Marsha Sawyer and her abscopal effect as the inspiration, Dr. Onik, with the help of Carol and Jim, discovered a way to make a patient's cancer into a personalized vaccine. In essence, he would immunize the patient against this cancer that had spread all over the patient's body, and the patient's own immune system would seek out the cancer and kill it in all the distant places that it lurked. When Joe Lee met Dr. Onik, he had completely run out of treatment options for his metastatic prostate cancer. Joe had had his original cancer removed with a radical prostatectomy. When it reoccurred, he had radiation therapy. When he showed signs that his cancer has spread to distant locations, he was placed on medication that eliminated his testosterone that the cancer was feeding on. While this hormone therapy works well for a while, in Joe's case, almost 15 years, it is not a cure, and eventually a patient's cancer will escape and become hormone resistant. When that happened to Joe, chemotherapy brought him to his knees and weakened his immune system to the point that he was repeatedly admitted to the hospital with a string of life-threatening illnesses. With no hope of a cure and the chemo no longer having an effect, he stopped his treatment and prepared to enter hospice. Medicine had nothing else to offer.
My name is Joe Lee. I'm 78 years old. When I was 54 years old, in 1994, I was diagnosed with prostate cancer. And I had it surgically removed by a surgeon who was the head of urology at Loyola University, and then had radiation after that. But we couldn't keep the PSA down where it needed to be, so I went on Lupron for about 15 years. And then my cancer returned with a vengeance. And it went back into my prostate cavity, and it was expanding into my bladder, and I was in deep trouble. I tried a couple of miracle drugs that didn't work. I tried 12 rounds of chemotherapy that didn't work, and ended up in the spring of 2014 with an impossible situation. The side effects of the chemotherapy were just devastating, and I was on my way out, quite truthfully, and I had made peace with the Lord, and I had a wonderful family to leave behind. And then through my brother-in-law, through a casual conversation, I found out about Dr. Onik. I located him in North Miami, went down to see him, and was very impressed with what he had to say about what he might be able to do to help me. And at this point in time, I could either pay Dr. Onik to take care of me, or I could give it to hospice, because I was going out the door. We went down, and Dr. Onik gave us a slide presentation. We walk out the door, my son looks me in the eye and says, "Dad, you got to do this." And we did it. In any event, in roughly May of 2014, Dr. Onik did the treatment. And so we went back to Michigan, where we're from, because we're snowbirds in Florida. Came back down for a second treatment, which was in the plan all along. And Dr. Onik said, "You're looking pretty good. Let's do some checks here." And he had a special way of sampling the PSA level and all that. And he said, "I don't think we need to do anything else. I think you're cured." He took my PSA from 28.5 to less than 0.1, and it's stayed there since then.
What happened to Joe was nothing less than a miracle, and he remains disease-free 3.5 years later.
Joe Lee was the first patient that I tried this new immunologic approach to prostate cancer. When I met him, he had every treatment that a prostate cancer patient could have. He had tubes draining his kidneys, his bladder, and basically he was going to hospice because there was just nothing left for him. He was a very sophisticated patient, had a son who was in the medical industry, and they came to me through another patient and said, is there something that you might be able to do? I had been thinking about Marsha Sawyer's situation and how there could be an abscopal effect and how we might enhance it. There now were drugs available to enhance the immune response. And so taking a number of things that were readily available and packaging them in a certain way, I was able to create a personalized vaccine in a very simple way for Joe Lee, and we got what was virtually a miraculous result. If God needed to tell you to keep doing something and pursue it, no matter what difficulties you were going to encounter, I believe that's the way he would send the message.
James Kaiches, a retired airline pilot, saw Dr. Onik shortly after he had treated Joe Lee. Jim was newly diagnosed with metastatic prostate cancer, which had already spread to his lymph nodes. Having just met the woman of his dreams, chemical castration was not something he wanted to consider.
Hi, my name is James Kaiches. I'm 68 years old, and I'm here to tell my story so that it can benefit other men in the future who hopefully will have the same results that I had. My story began about 5 years ago during a routine physical, and in the blood work that I did, it was determined that I had a relatively high PSA reading, around 50. Anything above 4 is considered abnormal and can indicate prostate cancer. So I researched it a little bit, and I went to see 3 different urologists, and each and every one of them said, you definitely have prostate cancer and we want to get you in right away for a biopsy, the traditional old biopsy, which has been going on for a long time. And I decided I didn't really want to do that, because then they said after the biopsy, we're going to either start you on chemo, radiation, some sort of drug therapy, and do this whole procedure. I started research and found a doctor over in the Fort Lauderdale area who I went to see, and he took a look at everything and he said, I'm going to send you over to another doctor that I know, Dr. Onik, who specializes in this type of treatment, but not the traditional type of thing. I did do that. I went over to the Fort Lauderdale area to where Gary practices, and he said, I need to do a biopsy. I said, well, doctor, what if I don't do anything? And without hesitation, Dr. Onik said, you're gonna die. He calls me with the biopsy and he said, okay, we've got one major lesion on your prostate that we're gonna have to take care of. And he said, you've got a lymph node adjacent to your prostate that's cancerous as well. He said, but we can take care of all of that. He said, so I'm gonna bring you in next week if you can do it, and we'll do the procedure. So after the second time, 30 days go by, I went in and got a PSA. My PSA had gone down to, I think it was 1.5. It was unbelievable. From 138 all the way down to 1.5. And He called me up, I think it was like 10 o'clock on a Sunday night on his cell phone. He goes, "James, have you seen your PSA result?" I said, "What is it?" He goes, "It's 1.5. It's unbelievable," which it was. It was a miracle. He calls me his miracle man.
Jim Kaichis was in a different situation than Jolie. Jolie had reached the end of the line. Jim Kaichis was newly diagnosed with metastatic prostate cancer. He had treatment options and effective treatment options, not curative treatment options, but options that would keep him going for a good period of time. The main one is chemical castration, with all the attendant problems associated with losing your testosterone. Jim was a young guy, had a new girlfriend who later became his wife, and he didn't want to take that route yet. My approach to patients is kind of what I call my medical golden rule. I'm not going to do something to someone that I wouldn't have done myself in terms of that choice. I have no doubt that if I was Jim, I would have chosen this route. And as you'll see, that has tremendous irony associated with it.
Jeff Lowe had reached a point where his prostate cancer had metastasized, and he was no longer responding to the chemical castration. Castrate-resistant prostate cancer gives a patient a life expectancy of 4 to 12 months.
I'm Kim Lowe.
And I'm Jeff Lowe. This is my wife. We've been married 38 years, dated 8 years before that, so we've been together 46 years.
We were high school sweethearts, and he told me in the 8th grade
December 10th of
that
our 8th
we were
grade
going to
year.
get married, and I, of course, told him he was nuts. So then we go forward to 8 years ago. We
Purchased a medical building to expand our daycare, Christian daycare centers. We had 2 locations, and we were going to combine them into one location. And with the money we had to borrow, everything our attorney said, we needed to upgrade our life insurance policies. So through that, coming to the house was a lady to do our physicals and all that stuff, blood work and everything. And we get the results back that I was denied.
Yeah.
So that's when I found out that I had prostate cancer with a PSA of 33.91.
You know, he went from being perfectly healthy and active and energetic, which he still was, but we find out that he has this horrible, horrible disease. So it was a major punch in the gut. And here we are, we have this building project. Our daughter just got engaged. We're planning a wedding, and we're going through extensive cancer treatments.
I was always so energetic, going and have my own concrete business, just getting up early and going and just work until the sun goes down and everything else, and not even think about stopping, having all kinds of energy, to sitting on the couch, staring out the window.
We got bad news from a 4th opinion doctor who actually spoke up and said the words no one else would ever say. He actually said, "I'm sorry, but you don't have long, and there's not going to be a positive outcome here." And we were floored. And that just wasn't okay. That was not going to be okay with us. And we just pleaded and prayed with God to show us, give us something. And by March, the wife of the guy who'd put in our security system years ago, she hooked us up. She's in cancer research with some scientists in California. And they requested Jeff's biopsies. And anyways, we were so hopeful that they were going to be able to do their genomic testing. And well, he called me in May and told me that Jeff's cancer was too advanced for what they do. But he very kindly told me that in all of his research, he knew of a man in Florida that we needed to go to, and his name was Dr. Onik. We'd gone to several different doctors, how many? To ask them about if we should go to Dr. Onik.
There was at least 4 or 5.
And they all said, no, I would not do it.
They said, don't waste your money.
Anyways, we went to Texas in April of 2016 and had some scans that Dr. Onik had sent us for, and they came back that the cancer was gone. It had worked. So then when we go to our doctor here every 3 months, like we always do, he's thrilled, and he is very open to learning and knowing, and he always is wanting all this information. But wow, just think, what would have happened if this hadn't unfolded this way?
Well, and how much more, if you didn't have to pay out of pocket, how much more this could help other people. August 11th was a year to the date of my last treatment with Dr. Onik.
We didn't realize that at the time.
At that time, but that was the cancer-free celebration. It was 1 year to date. God said, that's when you're going to celebrate. I don't know what we would have done without Dr. Onik and his treatment.
We're so thankful. It's so crazy how we came about to find him, but we're thankful that we did.
Part of our family.
So we have done something that is, in my opinion, extraordinary. I'm not sitting here today, I'm not actually completely surprised, because we thought it through. And once again, Gary, with that almost childlike fascination with what if? Why don't we try this? But again, anchored, fully embedded in the understanding of what's out there, what's going on, what are other people doing, what's available to us, and then apply it to solving this problem. He's done it before, and he's done it again. And I'm just honored to work with this man who I call a dear friend, a fabulous colleague, a pioneer, absolutely pioneer, and someone who is making a difference directly and immediately in people's lives. And we're just starting. There's a lot more to come.
So some of my patients are going on 4 years since the treatment. Why have I not published articles and done the things that most academics would have done up until this point? The first reason is that I had to be sure that this was real. I had to see it a number of times, that it wasn't just a one-time occurrence. The second reason is that this is based on my skill level. It's not generally applicable now. And we need to put an infrastructure together to do the studies that are necessary and follow the process that is critical to make sure that this is done properly. There are no shortcuts. This has to go through the usual approval process, the usual studies that validate, truly validate a new cancer treatment before it can be brought to large numbers of people. Now, the cancer experts that are going to hear this and see this are going to say, well, what he's shown you is irrelevant. It's just stories. It's anecdotal. It doesn't prove anything. And they're right. From a scientific point of view, it really doesn't if you're looking at it from academics and from that point of view. So why can I make the conclusions that I'm making? I'm only making them based on my experience of having developed a number of other successful cancer treatments, and I don't see why this one should be different. I feel that it is going to be successful. There are no shortcuts, however. There's no quick way that this can be brought to people. This is my skill level. It has to be turned into a procedure and a treatment that can be done widespread, and it has to be tested in the right way. So it has to go through all of the FDA processes that any treatment would have to, and there are no shortcuts. It's going to take patience, it's going to take resources, and it's going to take faith. Why? Because I've now become one of my patients. I now have metastatic prostate cancer. And using my golden rule, I now know that, yes, I would choose what Jim Kaichis chose as his first treatment.
You know, in my experience in medicine over 40 years now, life is full of ironies. The most ironically thing that I've ever heard in my entire career is when I received a phone call from Dr. Onik about 2 weeks ago, informing me that he himself has developed metastatic prostatic cancer. And as we all know, a very, very high mortality rate is associated with metastatic cancer.
We're covering 40 years of friendship, the emotion.
Yeah. It's hard. This is hard. It's one of the hardest things I've had to do.
For a moment.
Yeah. What's that, honey? For a moment. What?
His situation with his health at the moment breaks my heart. He has spent a lifetime helping others, and I will continue to pray for him every day for his wellness, well-being, and for him to get back to where he needs to be to continue his work. I know without a shadow of a doubt I would not be sitting here right now if it weren't for this wonderful man. I wouldn't be here.
My experience when someone is ill, such as the situation that Gary currently is in, is that prayer will strengthen his resolve to overcome this. I do believe that when people pray, that you get results. I do believe that there's strength in other people's faiths and in their putting you in their prayers, and I know that I will go back and ask my friends of all the different faiths to pray for my friend.
No question in my mind that a large volume of prayer for Gary from his former patients, future patients, and people in general would improve his chances of remission from this with this treatment.
Yeah, there's a reason. I mean, I told him at one of the treatments with Jeff, I told Dr. Onik, you know, whether you realize it or not, you are being used by God in a huge way, because we knew what was going on our end.
You can't get through it without prayer. It is a eye-opening thing. Prayer and my wife, God in my life, is what brought me through this.
You know, Gary, you know, this isn't easy.
Listen.
I mean, I know you're going through, you know.
No, I know.
You know,
it's not easy.
No.
But you know, the thing is, just like you said, you know, you have faith that this is going to work out.
I know it's going to.
And I do too.
Yeah,
and
I have no doubt about that. Yeah. That's not an issue.
And that's why it's, you know.
We just pray right now, you know where this prostate cancer is and you know the reason it's there. Mm-hmm. And we know that this is a change in his life right now. We just pray, Lord, that your Holy Spirit would just move through him right now, that he would sense your holy presence with him, that he would know that this point right now, and that you would just heal him, Lord, that you would remove this cancer from him and just bring great joy and blessings through this time to him, that he would know that through this prayer and through your work that cancer was healed. And we give you the praise for it in Jesus' name.
And how God works in such strange ways that he has a man who has devoted his life, his last 30 years of his career, to diseases of the prostate and how to treat or cure this disease. And then he himself develops the same problem. My first question to Gary was, how can you treat yourself? Because you are such a pioneer and visionary in this whole process. How are you going to use this incredible new technique on yourself?
He said, but I have another physician friend who I trust very much to do the procedure. And I said, but if you haven't trained him, how will he do it? He said, I'm going to do a spinal and be awake during the procedure and instruct him as he's doing it.
I have never, in my years in medicine, come across a similar occurrence where the brilliance of an individual led to what can, and I think will be, a revolutionary new approach to this disease and many cancers.
So I'm here asking for your prayers to give me enough time to bring this gift that I've been given to you. It doesn't matter what faith you are. If you believe in a higher power in God, then your prayers can be effective. So, if you're Christian, Jewish, Muslim, Hindu, Buddhist, and if I've left out another religion, I'm sorry, but I want all of your prayers. And I believe that if I get them, it will help me have the time to give you the gift that I was supposed to give you, that was given to me by God.